One of the most important things a school health officer can do is screen for and then respond to malnutrition. So with this skill and this action plan, we're going to give you a chance to put together a lot of the different things that we're teaching you over the course of this 3-day program. You've learned how to use a MWOC tape, which is the mid-upper arm circumference tape. And remember that we estimate easily 30% of kids in remote Kenya and even closer have malnutrition. So it's a really important thing to screen for because that's 1/3 of our kids. And that if they have malnutrition, it means that they can't learn very well, that their energy is lower, it increases their risk for illness and disease, and it'll keep them from being able to grow to be the healthy adults that we all want them to be. So once you've screened somebody for malnutrition, if their tape is in the orange or the red zone, even the yellow zone, we want to go ahead and start them on a re-nutrition protocol. What malnutrition means is that that child or adult has not had enough calorie and energies to support their growth. So they literally don't have enough food in their system to keep their muscles and body growing, and slowly their body starts to waste away. So to respond to somebody with malnutrition, you have to give them enough calories for them to be balanced, and then even more, because they have to have extra calories and extra protein to catch up and gain back the weight and the energy that they've lost with the time. There are a couple of other things that we need to do with kids who have malnutrition, and that's to think about why, right? One of our jobs as a school health officer is to start asking the question why. Why does this child have a headache, for example? Oh, I remember the #1 cause of headache is dehydration, so I'm going to give oral rehydration solution to that child. In this instant, we're saying to ourselves, oh, we've screened this child, they have malnutrition. Why might they have malnutrition? And so the school health officer will use a list of the skills that we've already been taught to go through and evaluate this child to see what some of the causes could be for the malnutrition. One of the first things we want to do is open their mouth, do an oral health screen, because the child may have a lot of tooth decay or an abscess, something that's causing pain and keeping them from being able to eat appropriately. The other thing we want to do is ask whether or not they've got diarrhea, because diarrhea causes malnutrition. And if they do, we want to give them zinc, because zinc slows diarrhea, improves the health of the gut, heals the health of the gut, and then prevents diarrhea from coming back again for about 3 months. Zinc is a wonderful thing. You want to use it for 10 days. The duration, the number of days you use it, is more important than the dose, the amount that you use. With children, it's about 20 milligrams of zinc every day for 10 days that we want to use. So we're checking their mouth, then we're checking to see if they have diarrhea. Another thing we can do as school health officers is a deworming, because worms, soil-transmitted helminths, cause diarrhea. So we want to go ahead and give them a dose of albendazole. And you can learn all about that in your School Health Handbook as well. We also want to look at the rest of the family, because if one child has malnutrition, it's very likely that other members of the family do as well. And we need to notify the parents and let them know that this is going on so that they can seek health care, and also so that they can educate themselves about nutrition and help make this child and the whole family better nourished. There's one more that's incredibly important: clean water. We want to ensure that this child has clean water. Some places you can boil water for 1 minute. Some places you can add bleach to drinking water and disinfectant to create a disinfectant solution. The amount of bleach is different. It's smaller for drinking water, a little higher for a disinfectant solution. Those recipes are in your book. So let's make sure that these children have clean water to drink. If bleach and firewood or kerosene are not available, use SODIS. That's when you put water in a plastic bottle, leave it out in the sun for 6 hours. Make sure you can see your fingers through that plastic bottle, and that demonstrates that the UV radiation is also getting to that water. Put the water up on your roof for 6 hours in the sun, and it will be safe to drink. So those steps will stop many causes of diarrhea. So will treating illness, which is why you want to bring the child to a clinic or a healthcare provider. After that, we want to provide more nutrition to the child. And so we want to use a special porridge that is made of grains and a little bit of sugar and more protein and some extra oil. The recipe for that is in your book. You want to start with 1 cup of any kind of liquid. It can be the water from making oats. It can be just regular water or broth. You want to add protein to that and also some extra oil. Research has shown that homemade therapeutic food is just as good for people who are moderately malnourished as any kind of therapeutic food like Plumpy Nut or the milk products. And actually, it's better to make your own RUTF than to use the store-bought and the kind that comes from the clinic. So you can do that right at home with locally made foods. We've got several recipes in here, and you can pick from them the things that are available to you and the things that your child likes the best. Please remember that when you add this special porridge, you also have to keep feeding your child their regular diet, because we're adding back calories. We're increasing their intake to help them catch up from the nutrition that they've lost over time. And you'll notice in the walk tape, it'll start to get bigger as the child's arm circumference increases. And that's an indication that their nutrition is improving. If you don't see that happen, please take the child to the clinic because they need to be evaluated for other forms of disease. And follow along with that walk tape, giving the extra porridge until the child is back in the green range. And when they're in the green range, it means that their nutrition is normal and you don't have to give them extra food anymore. So please remember that the porridge that you can make and give to the child or educate the child's family about should be given until the child gets back into the green zone along with all their regular food because it's catch-up. And then once we get back to the green zone, we can go back to the regular pattern of eating. Thank you so much for watching out for our kids.